every Filipino the right to health. And however, as mentioned before, the budget for health has always been below the WHO recommended 5% of GDP. You have earlier mentioned that you have some plans about resources coming from text messages and so on. My question is, as president, will you really view health as an investment? How do you plan to increase the health budget to be at least at the WHO recommended budget, aside from what you mentioned? And what you mentioned, are they enough for this increase in health budget, and where are the resources that you are going to tap them from?
I believe we will have more than enough insofar as the tax would be concerned. At the same time, I would tax cigarettes to the hilt. I don't know why we're taxing cigarettes on the high end, a higher tax, while we're taxing those at the lower end, 2 pesos. When our public, or the poor are going to be smoking that, and eventually, sila tayo rin na magbabayad pagkatapos ng magkasakit sila ng cancer. So dapat, i-tax natin ang sigarilyo ng todo-todo, irrespective of whether they are high or low. Why are we protecting cigarette houses? That's where you get the money. And you get the money from that, and when you get that money there, you can also get it, like I said, from text. Think about it, 2 billion text messages a day at 50 centavos is 380 billion a year. And meron pa tayong 170 billion sa education, 28 billion. That's 200 billion. So sa doctors at 5,000 times 50,000 times 14 months equals 3,500,000. A dentist, 1 billion, 1,894 times 50,000 times 14 equals 1.3 billion. But the nurses, at 24,000, 1.5, you can even pay the nurses 30,000. Midwives, 10,000 pesos. The health workers, 500 pesos. Yung barangay health workers, bayaran natin ng 3,000. Allowance lang yun. So you'll get 29 billion there, and you will be able to help primary health care. What do you have? About 40 billion pesos. So you can get that right away from the 170 billion that is supposed to go for education. It is now being covered by the tax and tax because you've already increased the salaries of teachers right away. And you will keep the teacher, and you will keep the doctor. That is the most important part about it. Ang problema sa atin, I will also make sure that the money we give, number 2, to ERA, which goes to local government, I will have flying visits, flying audits of the local governments to make sure that yung binibili nilang medicine tama, hindi under-delivered, at tamang medication. Because pumunta kayo sa health center, there is no medicine out there. There's not even any doctor out there. And I speak from experience. I can tell you that. Pag nahuli mo yan, matatakot tayo dyan, aabot ang medicine sa mga mahihirap at magkakaroon tayo ng doktor in every province. Hindi tayo magkakaroon ng doktor. You study 15 years effectively to become a doctor. Not counting the 4 years of pre-med. That's about 19 years, and then you're going to pay them 25,000 a month? You gotta be kidding. You need a doctor if you believe that.
Thank you, Senator.
Thank you very much.
Thank you. How do you increase the budget for health, and where do you get the resources?
I think the challenge is to evolve a continuing and sustainable system of providing healthcare. I'm not averse to imposing or levying excise specific or consumption taxes. However, the sustainability of the exercise based on projected shortfalls on demand after levying additional taxes may affect the continuity of any healthcare program, particularly on a sustained basis. Normally, though, if with past experience on government wholesale participation in any event, you still will have to plug the gap through taxation. Now, universal participative healthcare, to me, joining all under a single pool of usable funds for provisioning healthcare will provide the adequate covered base. So you involve private HMOs, private insurers, PhilHealth, remove all the distortions in the system where PhilHealth coverage, we don't exactly know how far it has gone. There are inequities in standards between and amongst local government units. We have to standardize that. But the basic premise is we have to spread the risk, meaning to say there should be a bigger pool of expendable funds for those that cannot afford, to include reimbursements of healthcare professionals. For example, a private person who can afford a private healthcare plan, fine. He must have one or she must have one. Let's allow he or she to have it, but there should be a levy on that private healthcare plan. And it goes to the national pool, so that levy can be used for reimbursing others who cannot afford. And that, to me, is one way of making the exercise sustainable. So it is a combination of various factors, taxation and having that kind of system in place.
Thank you. Secretary.